Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. Another exciting subject today. I am actually relaxing a little bit, less of the heat in Arizona. We've had over 100 degrees, and talking about a heat wave. The heat wave is very, very interesting for Arizona people, especially if you've lived here for any period of time. 100 degrees is pretty comfortable, to be honest with you, unless you're, of course, working out in that temperature. It really doesn't get hot for us that have lived in Arizona for a lengthy period of time until it hits about 110, 115. Then that's hot, to be honest with you. But overall, it's supposed to be in the 90s this week, about the next 10 days. So that's exciting in itself. With talking with a lot of fibromyalgia patients and listening to their comments on Facebook and so forth and so on. Again, the frustration is, are you a fibromyalgia patient and frustrated over the number of symptoms? And the frustration and confusion over symptoms in itself. I know we've been talking about this a little bit over the last couple of weeks, but I want to explain to you that there are 14, and I've talked about this over a year ago, about a year and a half ago. There are 14 other conditions that mimic fibromyalgia symptoms. So we're going to be covering all of these mimicking conditions, so to speak, and they're considered the most common misdiagnosed by doctors, believe it or not. So when a fibromyalgia patient goes in and explains the primary problem that they have, that's what the doctor wants to hear. Then he looks in that direction, and many times it has nothing to do with fibromyalgia per se. It has to do with a secondary condition. Now, I want you to understand also, for those people that have fibromyalgia, live with fibromyalgia patients, are interested in fibromyalgia, I've been working with fibromyalgia patients since 1990. During that entire period of time, I have not met one fibromyalgia patient that just has fibromyalgia. They have other secondary conditions. Oftentimes, they're the ones that mimic your symptoms, which is very, very interesting. Hi, George. Happy day. Hope you had a wonderful weekend. So this is very, very interesting as far as the fibromyalgia and the mimicking of symptoms with other conditions. I sent out some information on Facebook. We're going to be covering two of them in comparisons today. The most common one is CFS, chronic fatigue syndrome. And another one that's very, very popular that is misdiagnosed, hypothyroidism. Matter of fact, years ago, while working with fibromyalgia patients and groups, there was a doctor that came in, I believe, from Kansas City to do a seminar presentation. And he sold many of the fibromyalgia patients on the fact that fibromyalgia was a questionable condition. And it was really it really was a thyroid problem, hypothyroidism, where it is actually, hypothyroid is a thyroid hormone deficiency in itself. So he placed all of these people on thyroid medication and left. Well, the thing is that you really have to stay on the different types and different amounts of thyroid medication that you're taking to make sure that you don't overdo it either. That's very, very important. So a lot of fibromyalgia patients are walking around thinking they just have hypothyroidism, but they really don't. And that is the thing that we're really concentrating on over the next couple of weeks, is how easy it is for fibromyalgia patients to get confused with other secondary conditions. And also, many of the flare-ups that they're having may very well be because of the condition, the secondary condition they have. Instead of just fibromyalgia. However, fibromyalgia has been found to make all other secondary conditions worse. Okay, so if you already have a secondary condition, fibromyalgia has a good chance of actually making it more painful, more achy, more difficult to live with. So let's take a look at the chronic fatigue syndrome. Now, another thing about chronic fatigue, and a lot of patients don't like to hear this, that have chronic fatigue, but the vast majority of fibromyalgia patients, I find, have chronic fatigue also. All of them? No. Matter of fact, I was evaluating a chronic fatigue patient, and I explained to him that, no, you don't have fibromyalgia, you just have chronic fatigue. And he didn't even want to hear the word fibromyalgia as far as chronic fatigue is concerned. It was almost like that I was swearing at him. And I said, no, you can have chronic fatigue without fibromyalgia, believe me. But most fibromyalgia patients have some form of chronic fatigue goes along with it. So let's take a look at just the similarities of the symptoms that you have as far as chronic fatigue is concerned? Well, of course, the number one thing with chronic fatigue is fatigue. You have that chronic fatigue, and that affects something called memory and concentration. For fibromyalgia patients, that's called fibro fog, believe it or not, where when I ask fibromyalgia patients questions, it takes them a while to even answer many things because of the heavy fatigue factor. Something else that is common with both fibromyalgia and chronic fatigue patients is both muscle and joint pain. Which is very, very interesting. Now, you may think that you have osteoarthritis or rheumatoid arthritis or some of the other arthritides, but if you're young enough, most people under the age of, I'd say, 40, may not have osteoarthritis or rheumatoid at that point. And so that muscle and joint pain, which if it's not involved with osteoarthritis or the arthritides, we're not talking about any bone or joint or capsular destruction. We're just talking about muscle and joint pain. If you recall, last week I was talking about many of the symptoms that fibromyalgia patients have, many of the body systems, so to speak, and muscle and joint pain was very, very common. Now, another thing that's very, very common with chronic fatigue patients is another condition, headaches. Now, headaches is a separate condition, believe it or not, but chronic fatigue is very, very common. See how they start to intertwine some of these things? Actually, do you have just headache conditions, or is it part of chronic fatigue, so forth and so on? Another problem with chronic fatigue patients is sleep deprivation. And I find that obviously if you're going to have fatigue, it's going to be obviously made worse by the fact that you may not have normal sleep hours, so to speak. I always mention, people ask the question as far as, okay, so as far as sleep is concerned, what are the number of hours that you should sleep? Well, they have found that it's not hours as much as a full 90 minutes, a full cycle, so to speak. So you get deep REM sleep. And deep REM sleep is done in 90-minute cycles. So that doesn't mean that you're okay if you sleep for an hour and a half or 3 hours, which would be obviously 2 times one of the 90, or even 4.5 or 6 and so forth and so on. It varies from patient to patient. Mine that I've lived with for decades, I'd say, is 6 hours. Now, you can listen to the doctors and so forth and scientists, and they might say 8 hours or 9 hours, whatever. You can also oversleep, believe it or not. You can have too much sleep. But the most important thing is working on a full REM sleep, which would be 90-minute cycles. So if you're sleeping 6 to 7.5 hours, try to get the full cycle in. If you do get up before the full cycle, you may be a little jittery initially because your body didn't get that full REM sleep. But sleep deprivation is a real problem with both chronic fatigue and fibromyalgia patients. So let's go over these with you a little bit. Fatigue, memory, oftentimes fibromyalgia patients, we call it fibro fog or concentration, muscle and joint pain, headaches, and sleep deprivation. Those are the most common things that mix with fibromyalgia. There's other ones, but these are the ones that most patients I find talk about. So let's take a look now at hypothyroidism. Again, that's where you have thyroid hormone deficiency, and so they give you thyroid medication. I had, when I was just a little kid, so to speak, really young, I had hypothyroidism, and so they put me on iodine. And I was on it for a couple of years, and during that early period, believe it or not, one of the things that you have is weight gain. I was as wide as I was tall, so to speak, but because of the iodine, for whatever reason, either my body hormonally wasn't producing enough of it or whatever else, but I got through it, and all of a sudden I sprouted up like a weed. All of a sudden I wasn't so wide. I was a lot taller when I was younger. But let's take a look at the similarities between hypothyroidism and fibromyalgia. Again, one of the top things is fatigue. I already mentioned weight gain, and that's not uncommon. You can have either weight gain or weight loss with fibromyalgia patients. However, weight gain is probably more common with fibromyalgia patients as with hypothyroidism, because if you have fatigue, you don't have that activity session, and so consequently you have a propensity to gain weight just because of the fact you're not as active. Very, very common. Muscle and joint pain. Hey, now we have chronic fatigue, hypothyroidism, fibromyalgia, all muscle and joint pain, and we're not even talking about any of the arthritides again, the osteoarthritis and some of the other things. How things can mimic each other, right? So what do you have? What do you have? Fibromyalgia? Do you have hypothyroidism? Do you have chronic fatigue? Some of these conditions you can actually get tested for. We'll get into that. Hypothyroidism, of course, the T3, T4 tests and so forth that you can have. Chronic fatigue is primarily something that comes on very, very slowly also. As a matter of fact, you may have a sore throat. You may have something that is like a cold, so forth and so on, that can actually be evaluated. But let's get back to hypothyroidism. The hypersensitivity to cold, and again, this is very, very interesting. Fibromyalgia patients can have the sensitivities to cold and or heat, and so consequently, here's another symptom that you could actually have that could be confusing. Very, very common, hair loss. Fibromyalgia patients, believe it or not, have hair loss also. It's called alopecia. So especially for women, they have a tendency to really lose a lot of hair during this period of time until we put them on treatment that we have. But anyway, this alopecia, hair loss, is very, very common with not only hypothyroid patients, but also fibromyalgia patients. Constipation. For fibromyalgia patients, you could be constipated, you can have diarrhea, you can have one or the other. But again, it's a very, very similar type thing that you can have with hypothyroid patients and fibromyalgia. I mentioned the weight gain. That's another thing. Skin conditions. If you recall, last week I was talking about some of the many different conditions that people have, and one of them was dermatological, the different systems of the body. And this is a problem with hypothyroidism, oftentimes dry skin, so forth and so on. Depression, very, very common with hypothyroidism, along with fibromyalgia, because of the fact that many times it's not diagnosed properly or missed and so forth. So that's another thing. So it's very, very interesting. It also comes on, hypothyroidism comes on slowly. Oftentimes, like I said, misdiagnosed, very, very commonly misdiagnosed. So again, we're talking about fatigue, muscle pain, memory, concentration, like I said, fibro fog, joint pain, constipation, sensitivity to cold, hair loss, weight gain, skin conditions, depression. All of these things are very, very common with not only hypothyroid, but also fibromyalgia. So that's very, very important to understand. Now, again, chronic fatigue, that's another thing, is that it waxes and wanes, is what it's called medically. So it comes and goes. You can have periods where you feel just fine, and then all of a sudden after 6 months, maybe a year, boom, oh, you have this thing all of a sudden hit you between the eyes. There's no 18 specific points of pain, like one of the tests for fibromyalgia. It's not 100%, but that's very, very important. And no swellings, no nodules under the skin, which is very, very common for fibromyalgia patients. So that's some of the things that differentiate chronic fatigue from fibromyalgia. As far as, again, hypothyroidism, you don't have the 18 points. You may have some of the points, but not the specific tender points. And again, you may not have any of those nodules and swellings, so forth, underneath the skin. So I'll give you an idea as far as what we're talking about here. We're talking about, again, there's 15 that are misdiagnosed. The 15th is fibromyalgia. We're going to go over all 14 of those. They include Lyme disease and lupus and IBS and celiac disease and osteoarthritis, rheumatoid arthritis, headaches, all sorts of different things that we're going to be dealing with that have symptoms that are similar to fibromyalgia. Now keep in mind, fibromyalgia, all of the objective tests that are run on fibromyalgia are negative. That's X-rays, MRI, CT, all the different blood scans, so forth and so on. Now you may have something that comes up that might show for the secondary condition, okay? Secondary condition. But keep in mind that these objective tests are one of the ways that fibromyalgia is diagnosed. If they're all negative, it's not in your head, and you have all these pains and all these symptoms and so forth, wide, varied all over the body, you have fibromyalgia. That's what it is. However, again, you can have secondary conditions, all right? And you can guarantee that fibromyalgia makes these worse. And that's very, very important to understand. So if you're having flares, it could be your secondary condition is actually worse, okay? Is having a flare in itself. It could be rheumatoid arthritis, osteoarthritis, Lyme disease, lupus. Again, some of these, all of a sudden you may have heard, hey, wait a minute, I think I heard that that's kind of difficult to diagnose, isn't it? And many of these are. That's why they're the most misdiagnosed conditions in medicine today. And so that's why it's very, very important that we cover these so that you understand. Again, if you have fibromyalgia, don't put all of the blame on fibromyalgia, okay? You could have a secondary condition that is flaring up, that is causing a lot of the additional pain and so forth that you may have. So we're going to cover all of these most misdiagnosed conditions. And you're going to find that many of them, all of them have, let's put it this way, all of them have symptoms that are similar to fibromyalgia. And so that makes it even more difficult for doctors to diagnose something like that, since fibromyalgia is all over the board, includes all of the different body systems itself. Yep, we have covered the area. I hope you understand the differences between chronic fatigue syndrome and hypothyroidism and fibromyalgia. There's a lot of similarities, aren't there? Okay, well, you can understand, you can test for hypothyroidism. Of course, it's again a thyroid hormone deficiency, and so they can run T3, T4 tests and a variety of other ones. Chronic fatigue, a little bit more complex in that you have to understand the overall picture of chronic fatigue itself. It'll come and go. You have different symptoms, sore throat, and so forth, and so it is diagnosable. Okay, it is diagnosable. So I want you to understand it. We're going to cover a couple more, maybe 2-3 more next time. Next Monday at 12:30, we're going to cover 2 or 3 more of these misdiagnosed conditions that have similarities to fibromyalgia. I want to thank you very, very much. I hope all of the mothers out there, mothers and grandparents and everything else, I wish all of you that had a wonderful, beautiful Mother's Day holiday, and that you stay safe. And try to stay away from those people that are flippantly walking around and maybe dispersing the coronavirus. Believe it or not, it's not gone, okay? We have to adjust and adapt to what is going on in our world today, which obviously is going to be changing as they add more and more things. Keep in mind, the smaller the space that you're in, the more possibility, even if you're not sitting next to each other, okay? You have a more possibility that you may be picking something up from somebody else. They've actually tested people in the size of a volleyball court, and they actually found that people can actually get this disease because of ventilation, because of a variety of different things that happen throughout this virus. So hopefully we'll find inoculation so that we can minimize it. But in the meantime, the most important thing to stay healthy is you. Okay, you need to make sure you take care of yourself. Blessings to all. Hope everybody is safe, and look forward to next week. Bye bye now.